Namaskar, Sat Shri Akal, Adab, good morning, good afternoon, and good evening to all of you. जहां से भी आप हमें सुन रहे हैं. Thank you for joining our live session. My name is Kunjan Mawar. हम हैं आपके host और दोस्त for today's FB live session. Indian origin folks living in US. If parents are visiting from India and you are looking for medical consultation, well, look no further. eGlobal Doctors has your back. If you are looking to contribute in televisit and build your network, eGlobal Doctors is formed by a group of physicians from India, UK, USA, 300 plus doctors, board certified, 60 services in 8 countries. What isn't for doctors? Provide consultation, counseling services, patients from anywhere in the world, opportunities to provide charitable services to patients, be part of fast-growing innovative telehealth company with a chance to invest at a discounted price. Liability insurance will be provided. Visit or register eglobaldoctors.com. आज के हमारे गेस्ट हैं डॉक्टर एलिका डी गिरीश, currently working as neurologist at Edmond Health Orlando, board certified in neurology, epilepsy, neurocritical care, research focus on use of artificial intelligence technologies in neurological conditions. How are you doing, Dr. Gireesh, this evening? Thank you so much for sparing time and talking to us.
I'm good. Thank you. Thanks for having me in this program.
Thank you. So what do you say? Shall we just dive into our session?
Go ahead. Absolutely.
Okay. Okay. So we will be talking about epilepsy and seizures. So I'm going to start with what is epilepsy and what is the difference between a seizure and an epilepsy?
Okay. We can start with the definition. Seizure is essentially an isolated event of abnormal electrical activity in the brain. So it's a neurological condition. It's a single episode. It can happen anytime if there is any neurological issues. When it comes to epilepsy, it's more like a recurrent event, like somebody has an underlying tendency to have recurrent seizures. That's when we call somebody is having epilepsy. So seizures are can be suddenly triggered by somebody is having a low blood sugar, high blood pressure, suddenly fell, hit his head. All those things can cause an individual seizure that may not mean that he has epilepsy. Epilepsy is like when there is an underlying problem which leads to recurrent seizures. To put it in perspective, from a social perspective, it affects around 50 million people worldwide. That's more than the population of Florida, where I am living in, or if you take an Indian state, it is comparable to the population of Andhra Pradesh, one of the big states there. So. And if you look at the lifetime prevalence, what is the risk of somebody having the epilepsy, not seizure, okay? Epilepsy is around 1 in 100, 1 in 100 people will have seizure once, epilepsy at some point in their life. So the epilepsy, now we are focusing on epilepsy, that abnormal condition where somebody can have recurrent seizures. It happens in 2 groups of people, predominantly. One is in the younger age group and one is in the older age group. So we'll go more into the details once we go into the details of the.
So doctor, you did mention that there, if somebody has underlying conditions, what's an underlying condition?
So if we are talking about what is that underlying condition, what causes the seizure, it can be different. So depending on the cause of the epilepsy, sometimes it may be an abnormal neuronal tissue, the brain tissue sitting in the wrong place. When our brain is developing, the neurons are moving in particular directions. if they are not moving in the right direction, get entangled in one place, that can lead to epilepsy. That can be an underlying condition. Some people will have genetic problems. So some people will have an injury to the brain that caused a scar in the brain. Brain does not like scars. So that can cause epilepsy.
Okay, wonderful. Well, thank you. And that is a scary number, the number that you were describing. So
Right.
with that, I'm going to go to our next question. Like, what happens during a seizure?
So that goes to our definition of the seizure, right? It's an electrical abnormality. So if we go to the fundamentals, our brain is working through electrical activity. It's actually an electrical machine, just like our computer or like many of the electrical appliances that we are using, but very, very complicated, very advanced. Say, for example, if you are seeing a picture, signals are coming through our eye, going to the back of our brain as electrical signals. So brain uses electricity for that purpose. When this electricity goes like too much hyperactive, and sometimes if it is becoming acting in a waveform in a very synchronized way, and it start becoming almost like a forest fire, like a small fire that starts spreading throughout the brain. So that is the situation when somebody is starting to have seizures. So it's essentially abnormal electrical activity.
Okay, that's actually good to know. I did not even know there was a difference between the two. I often thought it was one term used for this second, similar. So thank you for that clarification. So what are some major kind of seizures?
There are different forms of classification for seizures that was introduced over time, like that are used in general parlance also. But in general, we classify it as either focal seizure, which is very limited to a specific area of the brain, or at least starting in one particular area of the brain. If you look symptomatically, say, what symptoms people are having, that's also another way of classifying the seizure. But generally, when somebody is having a seizure and not losing consciousness, we call it as a focal seizure, previously called as partial seizure. Okay. And then once they start having abnormal behavior, they are not able to respond to the environment appropriately. They are not able to understand what others are talking to them. Then we call it focal seizure with dyscognitive features, which essentially means their cognition skills are failing. And then at some stage, the same type of patients who have a focal seizure, which started only at one location, they start having generalized seizure. They go into a convulsion. Convulsion is that the entire body starts shaking. So these are the usual seizure in one category called focal seizures in different levels of their intensity. On the other hand, there is a group of seizures which start off as generalized seizure. Like at the start itself, the electrical activity is spread throughout the brain, and they are categorized under generalized epilepsy. So those are broadly two big categories. Then depending on which particular modality of our brain activity is mostly involved, say if you are having too much of shaking activity during the seizure, that is called one category, hypermotor seizure. And sometimes people you may not even notice somebody is having seizure. They just blank out. That happens a lot of children in their school or like in classes. Say the teacher is talking to them, they will not be able to respond, and the teacher may initially think that they are not paying attention, but actually they may be having actually a seizure at that point. So people used to call it absent seizure, but it can come under a generalized epilepsy disorder actually. So there are different ways of classifying it, but those are approximately the types that we are talking about.
Okay, so I do have a follow-up question. So that's actually good to know that if a kid is having an absent seizure and we as parents or teachers, we think that, oh, you're not paying attention or you're not listening. So what could be done during that time? Like, how do we bring them back?
So interestingly, it is the teachers themselves many a times bring this to the attention of parents, doctors, and all. Okay, only thing, unfortunately, many a times there may be a delay in bringing to the right clinical care and all. The important aspect is to detect it as early as possible. I will talk about why it is important in a little later. So like if you can detect if a child is having a seizure early, that will have a big impact on his life, because that will affect his academic performance, that will affect his ability to interact with friends, socialization, everything. So from that standpoint, it is extremely important that we detect it early, especially that type of seizure, especially if it is medically controllable type of seizure, that can have a huge impact on the future of that kid.
Okay, wonderful. That's actually good to know. So early detection of stuff like this is actually very helpful in a child's later years and overall holistic development. Okay, so what are the causes of epilepsy?
So if remember, I mentioned that there is a two age group in which epilepsy develops. So the causes also differs based on that. In the younger age group, or in medically calling pediatric age group, there are the underlying reasons are several. One of them is any birth related injuries, like injuries at the time of birth, the baby did not get enough oxygen, had difficulty breathing, had a cord, umbilical cord wrapped around the neck. At that time, the baby may have like breathing difficulties. Sometimes meconium aspiration, like aspiration of the amniotic fluid and all, that can cause breathing difficulties. That itself can lead to seizures later in life. Another cause is abnormal brain development, which sometimes for unclear reasons, there can be abnormal brain development. Metabolic issues. There are several metabolic reasons somebody, especially in the pediatric age group. It can be starting with something like a glucose related issue, but sometimes advanced metabolic issues also can cause seizures. We are increasingly recognizing genetic abnormalities as one of the reasons, and that is extremely important to recognize early also. More than all, I mean, equally important, but another important aspect that I want to mention is about febrile seizures. Febrile seizures are the seizures the kids get when they have a fever. People usually tend to ignore it. Like the kids will have one seizure and they recover, they go back to play, or the seizures, as soon as the fever is gone, there is no issues. Previously, we thought that is not causing too much of a danger to the kids, but increasingly now people are recognizing that the kids who had febrile seizures during childhood can develop what we call hippocampal damage. Hippocampus is the area of the brain that is related to memory, and these kids who had febrile seizures are at a higher risk of having hippocampal injury later, and that leads to seizures later also. So those are broadly the important reasons why kids get seizures, or at least in that particular age group, seizures start. Unfortunately, when the kids develop seizure at the age group, a lot of them will carry it to their adulthood also. In the adult world, like the seizure tendency or epilepsy tendency, I'm using both terms interchangeably pretty much, meaning talking about epilepsy now, okay? one major issue is stroke risk factors or stroke related issues. So stroke causes a scar in the brain, okay? And brain does not like scars. Scar is like if you cut your hand, you get a scar there. And same thing in brain also it happens. Brain does not like scar, and there may be a nidus of electrical activation around that region of the scar that subsequently lead to epilepsy. Hemorrhage is another reason. People, if it is due to high blood pressure, some people have something called subarachnoid hemorrhage or subdural hemorrhage due to either head injury or due to hypertension. They all can lead to subsequently to seizure and epilepsy because blood products are inefficient for the brain. The brain needs blood for its functioning, but brain want it to stay inside the blood vessels. If it comes out of the blood vessels, brain does not like it, unfortunately.
Yeah.
So then,
only.
It should stay in the right place. As long as it's staying in the right place, it's okay. Then the other concerning questions are like tumors. Like if somebody is having especially seizure at the adult life, one immediate question is whether there is a tumor and blood vessel abnormality. Sometimes the blood vessels may grow in a different way rather than the appropriate way of blood supply. Another cause is infections. If somebody has an encephalitis or meningitis, that can subsequently lead to seizures and epilepsy. In some, especially in the tropical areas, there are certain infections, especially parasitic infections like pneumocystis related to the tapeworm. That's how it's known as in the common parlance. Tapeworm can get lodged in the brain, and that can lead to seizure. A lot of them are very well treatable also, but you need to detect it early. So
yeah, that was my question. If we get the infections and stuff like that, and if we get treated, then it's not. Is it still considered that dangerous, or is it?
It depends on the intensity to which you got the infection. Sometimes, if it has caused scars in the brain, that may not resolve very easily. Just as I mentioned previously, scars in the brain can continue to cause seizures, epilepsy for a prolonged time, unless it is. There are strategies that people are thinking, like sometimes giving a steroid to prevent the immune reaction, control the scar formation and all. But it depends on how intense the infection was also.
Got it. So you mentioned about like when kids blanking out and we think they are not paying attention. So that's one of the signs that the kid might or is having a seizure. So what are some of the like signs for epilepsy, and how do we diagnose it? Like someone like me who doesn't know too much about medical, how would we diagnose that somebody's having epilepsy?
So just as I was mentioning, the teachers bring this to the medical attention, right? So that itself, that's a very important point. Eyewitness account. That is a very useful tool that we use to diagnose. Like, and nowadays everybody has a phone with a camera facility. So if somebody is noticing a kid having any abnormal behavior, or not necessarily kid, anybody, it may be worth recording a video of it. So that sometimes will help in making the diagnosis. So eyewitness account videos, they are usually one very useful way of arriving at a diagnosis. A couple of key features that we look at for seizures is, one, they are stereotypical. Means like every time it may pretty much happen the same way. Somebody may turn their eyes towards it, to the left or right, or the head may go to one side. So those are usually stereotypical, not 100%, because biology is never 100%. Okay, it's a very complicated network that is leading into dysfunctions. Another factor is the duration. Usually will not last more than 2 to 3 minutes. So that is one important aspect. Another important tool that we use usually is EEG, electroencephalogram. Remember, it's the abnormal electrical activity. So EEG is recording your brain signals from the surface of the scalp. It is not a very sensitive technique because, essentially we are getting a 10,000 foot view of what's happening inside the brain. But it is still useful. It is still used regularly. Only thing, it is not very sensitive. Many times, even if you don't have a positive result in the EEG, you still need to put it together with what the patient is reporting, what the eyewitness is reporting, and all. So there are, whenever somebody is having seizures, you need to get imaging, especially MRI. Is very useful in arriving at a decision on what is the underlying cause that led to this seizure. There are advanced imaging tools that we sometimes use: PET scan, SPECT scan, and magnetoencephalography. Magnetoencephalography is essentially a technique where you are recording magnetic signals instead of the electrical signals. But they are used only in advanced stages when we are talking about epilepsy surgery, like a surgery as a tool to as a method to cure this epilepsy. Other important studies that we talked about earlier, especially in the pediatric world, like in the children's, is metabolic, any abnormalism in the metabolism, in the urea cycle, those kind of issues. Genetic studies are increasingly used to arrive at sometimes simple things like a vitamin-related problem could be causing seizures. So interestingly, these genetic studies occasionally has been leading into a very good treatment option for the patients.